Welcome to this virtual World Congress of Nephrology 2021. I thank you for your support of the International Society of Nephrology's mission to advance kidney care for everyone, everywhere. Let me start by recognizing the contributions of the Scientific Program Working Group co-chairs who put together this exciting scientific program, and our colleagues from the Canadian Society of Nephrology and the Société Québécoise de Nephrologie. The ISN is different, and hence the World Congress is different from other nephrology congresses. The ISN is a society of its individual members, but is also proud of its strong and dynamic links with the various national and regional societies around the world. The WCN program has already started with a series of Raising the Curtain sessions in which we went around the world in collaboration with different national societies. My thanks to all for making it successful. I thank my colleagues in the ISN Executive Committee and the Council who steered the society during these last 2 years. It has been an incredible experience to be working with and learning from such fantastic leaders. The work of ISN requires contributions from volunteer colleagues who make the committees and working groups tick, with support from the committed executors of the ISN headquarters. All the outputs are the fruits of their consistent and selfless contributions. A big shout out to all of them. My 2 years would not have been possible without the support of colleagues from my institution and members of my research team who have tolerated my absences and pick up the slack during this time. My gratitude to my mentors cannot be expressed in words, in particular to late Professor Kirpal Chuk at PGI Chandigarh, an institution that was my home for almost 30 years. I and many others have learned so much from Professor Chuk. I was also deeply influenced by Professor Vikas Sukhatme at the Beth Israel Deaconess Medical Center, Boston, who took me in as an ISN fellow and allowed me to tinker in his lab. I learned the thrill of contributing to global nephrology from many ISN leaders, John Fieli, Beppe Remuzzi, Adira Levin, and David Harris, amongst many. I have been incredibly lucky to have the full support and love of my wife Sunita and the amused tolerance of our son Manik. Dear friends, COVID-19 has defined and perhaps changed forever we live and work. Most tragically though, it has taken away many we loved and we respected. We lost many pioneers who were instrumental in shaping the society and the specialty of nephrology. We mourn their passing, but resolve to carry on with their legacies. Let us pause for a moment to pay our respects to them. Friends, COVID-19 highlighted the disproportionate impact felt by the marginalized in our societies. In particular, the pandemic revealed the vulnerability of kidney patients. They were unable to get dialysis in many parts of the world, transplants stopped, PD catheters were not being put in, and chronic care in general got massively disrupted. During this time, the ISN did what it does best, by acting as a major source of collaborative information sharing, providing recommendations for preventing the spread of the virus, and assembling the latest articles, webinars, podcasts, infographics, global reports, official statements, and other tools on demands of the global nephrology community. Most of the educational instruments were homegrown within the ISN working groups and initiatives. We learned rapidly how to disseminate and effectively utilize virtual tools for knowledge sharing. Interestingly, for the very first webinar, where Dr. Francesco Iannuzella from Italy shared his experience, the traffic was so much that the virtual program crashed and we had to rapidly upgrade our capacity. I invite you to read the first-hand accounts from the COVID-19 frontlines worldwide as the narratives evolved and colleagues learned from each other on how to deal with this threat. The pandemic has revealed ever more the interconnected nature of the world we live in. As the WHO Director General Dr. Tedros said, none of us will be safe until everyone is safe. This is consistent with the ISN's mission to advance kidney health worldwide. Now is the time to do what the people of the world need us to do, so let's do it together. The ISN has always been a tireless advocate for kidney patients, most recently in calling for them to be prioritized for vaccination and in protecting their rights in those parts of the world where there is ongoing political unrest, such as Venezuela and Myanmar. Friends, we have come far from where we were 60 years ago when the ISN was founded. The kidney health community needs to be proud of its achievements. We have come out of the Tower of Babel in which everyone spoke a different language, whether it was naming, defining and classifying kidney diseases or using evidence-based approaches to deal with them. Kidney diseases are now recognized as a health priority by virtually every organization, in no small measure due to the power of advocacy by the ISN, through the World Kidney Day, the Global Kidney Policy Forum, partnerships with other kidney societies and multilateral organizations, not the least the World Health Organization, with which the ISN is in official relationship. Last year, the ISN organized the first international multi-stakeholder meeting that developed consensus definitions of kidney failure. These definitions should enhance the ability to conduct clinical trials, harmonize and compare results, and improve the evidence that allows us to determine the best therapies for those individuals who are living with kidney diseases. The Global Burden of Disease study reminds us that chronic kidney disease is the third fastest growing cause of death worldwide, and warns us that it would become the fifth leading cause of death in less than 20 years if left unchecked. A systematic review in 2015 had revealed one of the worst kept secrets in nephrology, that a large proportion of those who need care for advanced kidney failure die because they are unable to get it. Imagine, just during the time I have been speaking with you, 175 people with kidney failure would have died because they could not get treatment, all of them in low and low middle income countries. Friends, people should not have to sell their homes to provide care to a family member with kidney failure. It is a shame that currently only 1% of all incident dialysis patients in sub-Saharan Africa are still on dialysis a year later. We need to fight these structural inequities. People around the world should have access to decent care. As part of its program of work with the WHO, the ISN has developed a framework for providing care to patients with kidney failure. This framework is based on the concept of integrated care. It does not suggest a one-size-fits-all approach, rather presents a range of choices with focus on affordability and quality. Next, the ISN will develop a toolkit to guide its implementation and allow quality monitoring. More disruption is needed, such as that coming through the affordable dialysis machine, possible as a result of the visionary collaborative initiative of the ISN with the George Institute for Global Health and the Asian Pacific Society of Nephrology. The prototype machine that produces pure water from any source at the point of care and fills a PD bag, all at low cost, is getting ready for clinical trials. The ISN did not mince its words when it called the preventable deaths due to acute kidney injury, especially in the developing world, as a human rights issue, because that is precisely what it is. The 0x25 program calls for moving towards the goal of eliminating such deaths. The ISN's Kidney Care Network continues to look for sustainable and locally appropriate solutions to strengthen the capacity of primary care system to detect acute kidney injury early in resource-constrained settings. Demonstration projects are underway in Nepal, Bolivia, Brazil, and South Africa. As we go forward, I identify two critical challenges for us. The first one relates to finding ways to ensure that we can provide the care to all patients with kidney disease and associated conditions, irrespective of their geographic or social status. We know that it can be done, but need to develop sustainable, scalable, and affordable solutions, and then go on to actually deliver them to all the people who need them. We can indeed learn from examples in other fields, such as the last mile care provided by community health workers for maternal and child health conditions, vaccinations, and for management of diseases like HIV. Another game changer is mobile technology, something that has broken through during the pandemic. We need to come out of our silos and engage with all actors that play a role in influencing the socio-economic determinants of health and improve delivery of health care in the communities. The second big challenge is the one that fight against environment change represents. I suggest to you that kidney disease is the sentinel condition that will inform us about how climate change is going to impact human health. Indeed, kidney doctors are already seeing the impact, as evident in increasing reports of what we are calling at this time CKD of uncertain etiology. If we are complacent that this is not happening where we are, it is time to open our eyes. As we look around us, we find more and more examples. Dear colleagues, this existential threat posed by the environment change requires urgent action. We need a strategic plan. This means confronting where we must and cooperating everywhere. We need to get our allies in the game, pulling together to develop global capacity, which has been the goal of number one for the ISN for the last 25 years. The ISN's grant programs are unique in the world. I am not aware of any other professional society prioritizing this aspect in such a big way. These programs have produced leaders who will be the change agents in their environment. Listen to the words of Dr. Amar Swali, a young nephrologist from Tanzania who undertook a fellowship training at Muljipai Patel Hospital in Nadiad, India. He says, "The hands-on experience I have had has been to a level I could never have dreamt of, and I am lucky that my host institution always had faith in me to allow supervised interventions. This really allows us to make a difference in places where it is really needed." Or the multidisciplinary team of Professor Vanessa Bijol, a pathologist, Dr. Mala McKnight, a nephrologist, Dr. Patrick Voss, a radiologist, and Mr. Bernard Collins, a technologist, who undertook a series of visits as education ambassadors to Kigali, Rwanda, to set up a renal pathology service. According to Dr. Bijol, this was an amazing team effort and experience that all of us will remember fondly for the rest of our lives. I hope there will be more projects of this kind in places of need, and I would embark on a similar mission in a heartbeat. And finally, the heartwarming story of the 10-year-old Nan Yu Wai in Yangon, Myanmar, who was able to get a kidney transplant thanks to the ISN TTS Sister Transplant Center program. An encouraging development has been an increase in regional and South-side collaborations during training, facilitated through the ISN's regional training centers that make program delivery more responsive to local and regional circumstances, values, and preferences. We were very excited to launch the Emerging Leaders program to shape the future of kidney health. These outstanding young individuals, fired up with the common passion for making a difference, will work on finding new ways to impact the global kidney health agenda through collaborative projects. Forming these young talents into leaders today ensures better outcomes for our challenges of tomorrow. Research is indeed important for us to get to where we need to be. We need more globally representative and efficient clinical trials led by researchers from all parts of the world. The ISN Advancing Clinical Trial Toolkit and the Global Clinical Trials Focus are in the service of that goal. Membership to ISN Act is open to all. We encourage you to join and contribute in any way that you like. In the end, I would like to quote a number of hope: 617 million. That is the number of today doses administered worldwide of a COVID-19 vaccine. Although we all wish this past year would have played out differently, we do find reassurance in humanity's resilience and ability to find solutions in the time of crisis. These solutions start with science, global cooperation, and end with a commitment to equitable access to care and learning. It has been indeed an honor to be president these last 2 years of an organization that acts as gatekeeper of these values and principles. Thank you.